If I could pick out one product to order prior to ostomy surgery, it would be adhesive remover. Hey guys, it's Maggie and I am back today, and in today's video I'm actually going to be addressing adhesive removers, ostomy specific adhesive removers. I have been asked about this in comments before, and this is something that I really wish I had been exposed to early on with ostomy life, even before having my stoma. Not all medical adhesive removers are created equal, and some of them, while they can technically help you remove your bag a little bit easier and help you remove that residue on your peristomal skin, they might not help you out in the long run because it'll make your next bag not stick as well. When I had ostomy surgery, it was something that was unexpected, so I really didn't have any time to prepare myself mentally, physically, around the house, product-wise. There wasn't much preparation that could be done, so I had to learn after the fact. And I'm telling you what, if I had had some good ostomy-specific adhesive remover, I think it could have potentially helped me emotionally adapt to having an ostomy, because the removal of ostomy bags early on can be extremely painful. I remember sitting in the hospital probably 4 or 5 days after ostomy surgery, feeling the itchiness, feeling the burning around my stoma, knowing that something wasn't right. I'm telling the nurses and they say, hey, I think we need to do a bag change. And I just did not want to do that because I knew that every time that we were peeling the old ostomy bag off, it was causing me a lot of pain. My skin was so raw, it was so red and open and angry looking because I just had surgery. That stoma and skin junction was still healing. I mean, I had stitches that you could visibly see, but also we didn't know what products were going to work for me quite yet. We were trying out different things to see what really gave me a good seal around the stoma. And so I was still having some leaking, causing a lot of skin breakdown. That meant that every time that we peeled off a bag, it felt like we were ripping skin off, which we potentially were. Your skin's trying to heal. It's trying to have those epithelial cells grow, and we were potentially peeling them off every time we did a bag change, which was pretty frequent early on. So I was absolutely dreading it. I can picture exactly where I was in my hospital room. I was sitting in a chair, feeling miserable, and I said, "Nurse, what can you give me to help me remove this?" And they said, well, we do have adhesive remover, but it's not really meant for this. It's not the best, but we can give it to you to try. And I didn't even want them touching the ostomy bag. I didn't want them taking the bag off. I wanted to do it because I knew I could do it as slow as possible. So they came back in with these little inch-by-inch square pads, and you might know what I'm talking about. They were very citrus-scented, very oily pads. And they're more for removing like tape and stuff. They're not meant for peristomal skin where you want it to remain not oily, you want stuff to stick to it after the fact. And I spent a full hour just watching TV, sitting in this chair, like trying to distract myself, but slowly scrubbing the bag off. I took the wipe and kind of put it between my skin and the flange and slowly went back and forth to try and wipe it off. And I did get it off eventually, but the process, I remember just thinking afterwards, if I have to do this every time, an hour just to get the old bag off, how am I gonna live like this? How are we gonna do this? So that really kind of made me fearful to go home with the bag, because I just thought, this is a process. Now, over time, my skin did heal. That junction between the stoma and skin did heal, and we figured out what products worked a bit better, so we got a better adherence, and that way I wasn't leaking as much, causing more skin irritation. Things did improve, and I got to a point where I could peel the bag off. It did take some time still, but I could slowly peel the bag off without nearly as much pain. But I still kept thinking, there's gotta be something that would work a little bit better, that would be helpful to reduce the pain, especially if you've got really raw skin, and just make this an easier process. Turns out there was. Now, I don't know how readily available ostomy specific adhesive remover was about 15 years ago when I got my stoma. I know that in the hospital, they didn't have it. And I'll tell you, I wound up working on that same hospital floor in that same hospital about 10 years later, and they still didn't have ostomy adhesive remover. That may have changed, and different hospitals may carry different supplies, but it's one of those things that it's not a guarantee, and that's why I say, man, if you can order it before you even get stoma surgery, I think it's worth it. So they do come in two different forms. They've got the wipe version, which is sort of similar to what I was given in the hospital, except for definitely improved for peristomal skin. And then they've got the spray version here. And I like having both on hand because I think that they work a little bit differently and they work better for different purposes. Now, most ostomy manufacturers do have their own versions of this, and most companies do provide a wipe and a spray version. Hollister's got a version, Coloplast has one, Trio Ostomy Care has one, Safe and Simple, and then Convatec, which is what I have here. So why do these adhesive removers, these ostomy specific ones made by ostomy manufacturers, why do they work better than just the ones you can find in the hospital that are oily and citrusy and all that nonsense? I think the first thing is they reduce pain. And I don't think, like, even as a nurse who cared for ostomy patients, I didn't oftentimes think about the pain aspect of changing an ostomy bag, but which is kind of funny since I had a stoma myself. But you kind of just focus on, like, let's get the bag to stick well and let's not have it leak. You're not thinking about the removal process, and that is such a huge factor. And what I love about both of these is that they don't have any alcohol in them. A lot of products contain alcohol, and holy cow, that burns. I mean, even if you don't have any raw skin or anything, I avoid products that contain alcohol like the plague because I have little granulomas. And if any alcohol gets on them or any irritating substance at all, that burns. I don't want anything to do with it. Adhesive removers like this can really help you remove the bag painlessly. Kind of just helps everything melt away really nicely. Whereas I feel with the other adhesive removers, you know, the oily ones, it takes a little bit more work. It takes a little bit of scrubbing and really trying to clean to get things taken care of. These guys are also, and I did look through most of the brands, most adhesive removers for ostomies are silicone based, and I think that must be the common factor that really makes them work well. I think the sprays are fantastic for removing the whole appliance, and I'll show you how I do that in just a moment. But then I think the wipes here that are quite large, let me show you. This is an open wipe. I just opened a few minutes ago. They're quite a bit larger than your typical adhesive remover. These are really good at kind of the fine tuning, the cleaning right around your stoma, getting rid of any residue, because you really want a perfectly clean surface. You don't want any leftovers from your previous bag because that can make it so your next flange won't stick very well. So my routine has been to take the spray, I will spray it on usually the top of my flange to get it going, kind of peel it back a little bit. And then as I go, I'll spray, peel, and it truly feels like the bag is kind of falling off of you, which is exactly what I would have wanted when I was 16 doing this, rather than me like kind of scrubbing with this tiny little pad, trying to get the bag off really slow. This makes it so much faster where I can do it very quickly, even if I do have skin irritation, even if it is a little bit sore. Thankfully, my skin has toughened up over the years, and your skin will tend to do that. But even to this day, like the fabric border on my flanges now, it really sticks to the hair on my belly. So this really helps with that. And then once I have the flange off, I'll go in with the wipe, and you know, thankfully I can fold it around, use one corner of it to really clean the outer edges. And what I really like is it makes your skin look nice and clean too. You can get rid of the bits of adhesive that have gotten fuzzies on it, that are on the outer edges. So I start around the outer edges, clear all that stuff up, and then I work in towards the center, towards my stoma. and that's when I get all the little residue from my barrier ring, anything that's left from the flange, just anything that could impede the tackiness of my skin. Rarely I will wind up needing 2 wipes if things are a little crazy. Usually there's a little bit more residue if I leave my bag on longer, which I've been doing a lot lately. But for the most part, I can get away with just 1 wipe, and it just makes it really easy to clean the surface off well. The thing about these adhesive removers that I have personally found with my insurance and my supply company is that either my insurance will not cover it or my supply company does not offer it. And right now it's a little bit of both. They're sending me adhesive remover that I will not use. It stings my stoma a bit, or it stings the skin around my stoma. So I don't know if there's alcohol in it for sure, but it definitely does not feel as comfortable as these. This is a product that I will purchase out of pocket. I think it's worth it for that. Now, I looked through most of the brands, the ostomy manufacturers that make these adhesive removers, and a bottle of 50 milliliters, this is actually 150 milliliters, so the bottles are usually a little bit smaller than this. I went for the Big Daddy. That's how much I use it. But the 50 milliliter bottles will typically run you around $20, anywhere from like 17 to maybe 22, 23 US dollars. And same goes for a box of these adhesive removers that contain between 25 and 30 wipes. It's usually around 20 US dollars. This guy, this is the 150 milliliter bottle. This is the Ascenta Convatec one that I've worked with Convatec before, so I know I've shown you guys this, but I purchased this. I'm not working with them right now. I genuinely love their products. This one I think cost me about $60, which is on point for, you know, the amount that I'm getting in here, and the $20 per like 50 milliliters. So yeah, it just depends with your insurance if they will cover this, because it's kind of like, I don't know, I don't want to say bougie, it's not. I think this should be given to every patient. I think it should be covered because it's just so helpful for getting your next bag to stick. Honestly, I think these companies would save money because you would be using less ostomy products, but whatever. Yeah, I don't make the decisions. But yeah, you have to check with your insurance to see if this is an item that they'll cover. Check with your whatever company you use for supplies to see if they even offer it. I think with the company that I use Adapt Health. I wouldn't necessarily recommend them because I've had some issues. They have, I think, maybe the Ascenta wipes. This is not the Ascenta wipes. This is actually an old version of the Convatec adhesive remover wipes. But somebody sent them to me and I have a whole bunch of them. So I'm just using them up before I have to purchase my own. But I think this is the only thing that they carry in the Ascenta line. I don't believe that they have, at least, this is what I was told by one person. I don't believe they have the spray. And with their other Ascenta products, like the skin barrier, I really wasn't given a clear answer. You know, we try our best. But yeah, I would say that with a 50 milliliter bottle, it actually lasts me quite a bit of time. I would say at least a few months. This guy is gonna last me a while. I would say at least half a year, if not longer. I've had this for a couple months already. I get a lot of use out of it because I'm very careful. You know, I'm not spraying like crazy. I just spray where I need to, and I've used this for other stuff too. Like it's adhesive remover spray, so I have used it for when I use the K-tape for my belly for pregnancy. I've used it for removing band-aids and stuff that are sticking a little too well. I've used it on Zach before if he has tape and gauze and stuff. There was one time when he got a cut and I was in bed, so I did not bandage his cut. He did it, and he used micropore tape, and he put it like all around his arm, all on his arm hair. And when he was trying to pull it off the next day, he was miserable. And I said, wait, I've got something for that. And we use this. It works great for that stuff too. I have even used this stuff, actually more the wipes, if I want to save, this is gonna sound goofy, if I have a candle that I like the jar of, you know, I finish the candle up and I want to get the label off, but it rips off funny, I will use this. It works great. So it definitely has its uses. When it comes to the box of wipes though, I think they come in a box of 25 or 30. I don't remember for this. I think the Ascenta ones are 25. Since I only use one, maybe two, maybe on the rare occasion two per change, and I change like every 4 to 6 days, that lasts me quite a bit of time, a few months. So, you know, the cost being maybe $40 if you want to get one bottle of the spray and then one box of the wipes, that could last you 3 to 4 months. To me, that was worth it. To me, I was like, I will buy this out of pocket. I think that price is reasonable. And I could definitely do that. And I don't feel that way about every Ostomy product. There's some stuff you can get away with, you know, cheap like skin barrier and stuff. But adhesive remover, I just think, yes, you have to go for the good stuff. And I think that you'll find it helps reduce your pain. It helps make the change so much faster and gets you back to whatever you want to be doing. You know, you don't want to be doing your ostomy bag change for over an hour like I started off. One thing that I've had people comment though when it comes to these adhesive removers is that sometimes it's recommended to rinse it off, like rinse your skin off after using them. I have been using adhesive removers for probably at least 10 years, I'd say, maybe a little bit longer than that. I have never had any issues with like irritation from this sitting on my skin. It really, once you use these, you'll notice that your skin is left very dry, which is extremely helpful for when you place on your next ostomy bag. So I have never felt it necessary for myself to rinse my skin off after using this. I typically will use the spray to remove the bag. I will use the wipe to clean the skin really well, and then I'll just go into prepping my skin with the skin barrier. I don't find the step of rinsing my skin necessary. I also think that that just adds time, potentially frustration, because it's, you know, you gotta wait for your skin to dry after you put water on it. This stuff dries immediately, and I even notice that my fingernails will get dried out if I get any of this stuff on it. So it does definitely provide you a nice dry surface to work with, which is what you want. You don't want that oily residue that the non-ostomy adhesive removers leave. But something to think about, if you notice any irritation after using this, you might want to take like a water wipe or just maybe a little toilet paper with some water to clean it. I also think it's really important to mention, because anytime I talk about or show an ostomy routine, people are saying, hey, that's not sterile if you use toilet paper around your stoma. Remember what comes out of my stoma. It is not a sterile procedure. Ostomy changes are not sterile procedures. In the hospital, your nurse can absolutely use gloves and should use gloves because it's a bodily fluid. For yourself, I equate it to, you know, I'm not getting my ostomy output on my hands purposely. I try to avoid it. I'll use toilet paper. It's perfectly safe around my stoma. I equate it to somebody wiping after they go to the bathroom. Like, are you wearing gloves to wipe? Probably not. But if it makes you feel more comfortable when you do those ostomy changes, go for it. I think I started off with gloves and then I realized, you know, this is too much. This is annoying. So, you know, make sure you practice proper hand hygiene, washing before and after an ostomy change, and you're good. So anyways, those are my thoughts on adhesive remover. I did want to talk about it in depth. I would say that if you're searching for a specific ostomy adhesive remover, think about what brand ostomy bag you use currently. If you use Hollister's likely got one. Sometimes it's easier just to stay within one brand. I think if I could tell you my favorites from over the years, and I have tried Hollister's, I have tried Coloplast, and I think I did try Safe and Simple maybe 5 years ago. I had a couple samples, but my favorite two are from Trio Ostomy Care and Convatec. I think those have been the best performing, and I also selfishly like the packaging the best. If you have to travel with them, I think this doesn't necessarily look like it's a medical product. Whereas some of the others, like, you can kind of tell. But yeah, I just, this has been the best performing for me, and it's just what I've stuck with the longest. So those are my thoughts as an ostomy patient and nurse with a stoma. You can't go wrong with an adhesive remover. If you can only afford one, get the spray, because you know what you can do is just spray a little bit of this on toilet paper or paper towel or something and create your own little wipe. But if you can order it before you have surgery and just go to the hospital with it, it could potentially make those first few changes a heck of a lot easier. I will put links for these in the description below. I'll find them on Amazon or something, so that way you guys can take a look. But yes, I love them. I love them. It's one of my favorite ostomy products. All right, guys, hopefully this was helpful. If you are struggling with removing your ostomy bag and having a lot of pain, this is the way to go. This is the thing that I think will help you the most. Yeah, thanks so much for watching, and I'll see you in the next. Bye, guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel, like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.